Well, in just a few months, the coronavirus has spread throughout the world, and with the strict social distancing regulations, it may be difficult to protect refugees who are cramped in spaces with no proper water or infrastructure. How are they being protected during this outbreak? Well, for more, I'm joined via Skype now by Doctors Without Borders, South Africa. He's a director, Rodd Gerstenhaber. Rodd, good morning, and thank you very much for time. You are in South Africa. Perhaps we could start there, and just to understand, in places like Khayelitsha, where one person has already been confirmed to be infected a few days ago of COVID-19, what is Médecins Sans Frontières doing on the ground in places like Khayelitsha?
No, great. Thanks for having me. And here in Khayelitsha, we've been working very close with the local Department of Health for so many years, and it's the same here in COVID, in the COVID response. And MSF's been very active for several weeks now in Khayelitsha. One of the main things that we started with was attempting to ensure that we could protect our own staff and trying to equip our staff. But as everyone's aware, personal protective equipment is very scarce, so it's very difficult, but we're trying to do that, and we're also assessing risk for our medical staff if they fall into any type of high-risk category. That's one. But then for the communities, we've been working on strengthening health promotion. We printed 40,000 flyers from the Department of Health. We're putting them all over. We're trying to strengthen social distancing measures, so we have people that are working on queues to make sure that people respect a bit the queues and the distance. We're doing social media campaigns around hygiene and health promotion, hand washing, cough hygiene. We're using Facebook quite a lot and targeting Khayelitsha as well with that. There's quite a lot of users. We've been doing contact tracing. So when there was that first case, as you mentioned, MSF the next day was on the scene with Department of Health, and they were helping to screen and see if anyone was symptomatic in the area, and also if we could find any known contacts of that patient. So that's an important step, because in the epidemic right now, we're still looking at flattening the curve, we're looking at containment. So if there are cases identified, symptom screening in that particular area becomes quite key. All the clinics have also been assessed for their triage measures and screening measures. So the Khayelitsha clinics, there are 14, and they all have some measure outside the clinic where they're able to have some sort of screen where they can either screen for symptoms of COVID, but also they're having a check to see if the patient really needs to enter the facility. Anyone that can be sent home before going into the facility would be great. That means they're not ill. Maybe they just need a refill. And one final thing before you come in, in the same line of decongesting the clinics, one thing we initiated just this week with the Khayelitsha Eastern Sub-District was delivery of ARVs at home. And yesterday we delivered 1,600 packs to community pickup points. And from that community pickup point, CBOs, which are community-based organizations, they come and collect them, and then they distribute them to the homes. We've been doing this now today's the third day, and this is a fantastic initiative to make sure that patients, that all they need is a refill, and these are, in the case, HIV-positive patients. They don't have to go to the facility. They can stay at home.
No, it sounds like Médecins Sans Frontières has got a very comprehensive, holistic approach there in Khayelitsha. Are you using the same kind of approach in Khayelitsha that we are using in Khayelitsha elsewhere in the country? The MSF, Doctors Without Borders, also are sitting in other parts of South Africa?
For sure. So we have projects in Ishawe in KwaZulu-Natal. We have a project in Rustenburg in the northwest, and we have a project in Tshwane in the capital. And in all those projects, we're addressing similar issues, particularly around health promotion, trying to make sure that there's also screening and possibly testing in the future. So testing is a big issue at the moment. The president has launched a testing campaign, but still most of the testing is lab-based until there's some sort of agreement upon which type of rapid test. A rapid test would be like an HIV test, where you just prick a finger, and in 5 to 15 minutes, depending on the test, you have the answer. At the moment, there are many different varieties of them, but there's no agreement on which one is the best. So testing can scale up as soon as that type of test
the minister,
is
the health minister yesterday in Durban, Dr. Mkhize, did speak about that, and that they're trying to find which one would be the most appropriate. Now, yes. Before I let you go, Rodd, my original request to speak to Médecins Sans Frontières, I don't think was properly communicated to you, but I have to ask you, in case you can give us a sense about refugees. I mean, On the African continent, in different parts, we have refugees because of conflict and other reasons, and also in the Middle East and elsewhere in the world. Médecins Sans Frontières, I know that globally you are very much in the thick of things in many refugee centers across the globe where your colleagues are helping people with all kinds of health challenges. Under the COVID-19 outbreak, the pandemic we're faced with, what's happening? Can you give us a sense from what your colleagues are telling you? Just what's happening? How are refugees coping? How are they managed? Because they are cramped in all kinds of camps, and at the best of times, no infrastructure, no water, and to maintain hygiene, physical and social distancing will be tough.
Yeah, no, in certain contexts, it can be nearly impossible. Just to highlight, there are millions of refugees around the world, and MSF is supporting refugees in many places like Greece, like Lebanon. But in South Africa, there are no camps, for example. There are no refugee camps. What's happened in South Africa is homeless, or people that are living on the street during this COVID lockdown have been moved to other facilities like stadiums and other types of places where they can be held or at least accommodated. But it does kind of become a risk, which is it's not a camp per se, but it's similar where there's a lot of people that are going to live in one small area. And we do think that it's a priority that this population within South Africa make sure that they have the right prevention measures for COVID, so that they have hand washing or access to hand sanitizer, that maybe they're provided health promotion messaging as well. So there is this potential that there should be an escalation of services to those groups, because they are living in a very congested area now during this lockdown period. Now, for the rest of the world, MSF is looking at the same. So if there are camps where they want to make sure that provisions are made to, one, prevent the entry of COVID, because, as you said, it runs the risk of disseminating of infecting many people in the camp. And this is the same: health promotion messages, access to water and sanitation, access to all of these things that we all know about how to prevent COVID, social distancing. But as you said, it's nearly impossible with so many people cramped in a place like Lesbos in Greece, where they have 2 to 3 times the number of occupants in the camp that the camp should originally hold. So, but prevention, I would say is the main thing.
Rodd, thank you very much. That's Médecins Sans Frontières there.